Good afternoon, Dr. Neelima Reddy. Thanks for joining us today. Let's talk about the COVID situation in India and how we can help today. So, as we can actually see, the world can see that the situation in India is grim. Lots of lives being lost, and every day there was more, and it's projected to be about 1 million by the end of August. Obviously, we all know the situation is because we have a lot of cases that happen really quick, really rapidly, and it's hard to manage when things happen so much, so fast. There's a lot of lack of resources, lack of services, healthcare systems, everything around is falling apart. We're losing lives. We're actually seeing family actually helping the patients in this crisis. And you can imagine what happens when a family member is actually caring for a COVID patient. I know Ekam has been called upon to support. So what has Ekam been called upon for? And what is Ekam going to do to support the crisis, to help better the situation?
So since Ekam is already on the ground and working with the hospitals, and previously since last COVID wave, 57 hospitals have actually reached out to Ekam with the requirements they need to take care of these growing number of patients, including the oxygen cylinders or oxygen concentrators, EKG monitors, simple things like N95 masks and gloves that you can maybe take it for granted right now, and including oxygen, physician protection kits, and community COVID protection kits for the family members that take care of their patients as well. And of course, livelihood is affected and all of the community cannot afford. So we have to give them urgent food supplies as well. So all these hospitals that have reached out to Ekam, we are trying to support them in providing all the necessary equipment.
Thank you so much. That is wonderful. So why did these hospitals, you think, chose Ekam?
So since 2009, Ekam has already been on the ground and working with the existing infrastructure with the government hospitals. So the hospitals and the doctors are already comfortable and they can trust Ekam with the previous experience and expertise that we've had, whether it's in providing equipment or training or recruiting doctors and nurses. And we work with organizations like UNICEF in providing maternal child health care, and right now to roll out the COVID vaccines and helping them to keep the mother and child health in the setting of the COVID crisis. We partner with government and work with the government infrastructure, and they trust us to do the work that is to be is immediate at this time. Most of Ekam USA is run by physician volunteers who put their passion into the cause. And we've supported India during the last COVID wave with about 200,000 that we've raised and sent for funds in India, and about $72,000 that we've raised and spent for COVID relief in US as well. And 100% of the donations we are able to send to the project work because of the volunteer basis of how Ekam USA works. And Ekam Foundation in India is able to do this because they have staff on the ground that have already been there and have the reach to the remote villages as well as towns, and the people in the community are part of Ekam. We train them so they are able to identify the needs more immediately and address them quickly in a cost-efficient manner.
I think it's really good that you have resources and you know people and you know the system, because that really will help to distribute all your support. How can we actually help Ekam in this effort? How can community or people here support the situation in India?
So we have the right platform. We're able to connect the donors here to actually directly to the hospitals that they want to support, or to the different kinds of projects, food relief and other projects too. So we have all the information on our website at ekamusa.org. That's ekamusa.org, where you can see the different types of projects and what kind of activities we've done until now and what we're doing right now. Any amount helps, of course, but we have a large need with this number of cases, and each oxygen concentrator is about $1,000. So we are raising funds for oxygen as well as PPE, and with a goal of about $200,000 is what we are raising now to provide the immediate needs of these hospitals that have reached out to us. So any donation would help, because all of it is going towards the project, and we can do a lot more to save lives at this time of crisis.
So we can go to ekamusa.org and we can find the project that we want to fund, we can support, and we actually make our donations. Any amount is okay. And your goal is to raise about $200,000.
Yes. And thanks to all the donors that are
Thank you.
helping us in this effort.
This is the time to help, and we can help in any way that we can. And we can actually help humanity rise with this effort, support the cause. Let's prevail as a race. Thank you. Thank you,
Thank
Dr.
you.
Nilima.